Hi, this is Dr. Ashok Muthaya. Post internship, when I was an observer with an homeopathic physician, one of my relatives who was suffering from fever since last 7 to 8 days, not responding to any kind of antibiotics, came for treatment and he recovered within 2 days. That raised my confidence of treating cases of fever. Now I will present you few cases of fever. Now case number 1. This case was taken on 16/7/2011. 2-year-old boy brought by father with a history of mild cold. There were no other symptoms like any headache, body ache. The stool and the urine output was normal. The child was active. I prescribed him Pulsatilla 1 mg for 1 day as the symptom was of milder intensity and as Pulsatilla had acted upon him previously also. The next day the father calls up and says that my son has got fever. That is around 100 degree Fahrenheit. He told me there were no symptoms along with that. I told him you continue with the same medicine. Now what happens the next day? The father brought the child along with him. The father was in a little panic state. He told me, sir, that my son has got continuous fever since yesterday and it was ranging between 101 to 103 degree Fahrenheit and it was more in the afternoon time. The discharge from the nose has become greenish. He has developed leg pain. He had vomited once. Now basically the vomiting contained whatever he had eaten. When I examined the child, on examination I found that the lips were red. Along with that, the child was dull. Now if you see the overall picture, the totality would come closer to remedy like Lycopodium and Pulsatilla. Since Pulsatilla covers the totality, it was thought that increase in the potency would be necessary. So accordingly, Pulsatilla 10 mg QDS was prescribed for 1 day. The child recovered within the second dose. The fever and the cold subsided down. So Pulsatilla 10 mg QDS was given for another 2 days and the child recovered completely. Now what we learned through this case is that we need not change the remedy. We need not change the remedy if the earlier remedy is covering the totality. Second thing that maybe Pulsatilla 10 mg in the beginning of the illness would have reduced the intensity of the disease. Now I will proceed to case number 2. This is the case of a 7-year-old girl who was brought by the parents with a history of watery nasal discharge, sneezing, rattling cough and fever was there since last 2 days. Now the fever was more during the evening time and it was around 103 degree Fahrenheit. On further inquiry, the parents told me that the child was restless during the fever. I thought I got my remedy. I was thinking of arsenic alb. So to confirm arsenic alb, I inquired further regarding the thirst. The parents told me, sir, the thirst was increased and the child was drinking half glass of water frequently and he had a frequent urge to pass urination also. On seeing the totality, we would think of remedy like arsenic alb. But if we look closely, the most prominent symptom of the case is frequent urge to pass urination. So, considering that symptom and referring BBCR at the heat and fever section with concomitant urination too frequent, Lycopodium and Rustox was the marked remedy. Lycopodium was prescribed because of the evening modality. After giving Lycopodium, the child recovered fully within 2 days. The fever, the cough, the sneezing came down. Now, the important lesson what we learned through this case is that concomitant is important. BBCR is the better repertory in treating cases of fever. Now I will proceed to case number 3. This is also an interesting case. This is the case of a 56-year-old female who came with the chief complaint of fever with chilliness since last one day. She was complaining of severe headache. Along with that, there was marked increase in thirst. On further inquiry, there were no other symptom. Apart from headache being the most prominent symptom, there were no symptom. So considering headache as the most prominent symptom and referring BBCR at the heat and fever section with concomitant headache, natromur was the most marked remedy. So I prescribed natromur 10 mg QDS for a day. Now what happened is the next day the patient came complaining to me that the fever has become continuous since yesterday and it was ranging between 102 to 103 degree Fahrenheit. She was complaining of severe headache, severe body pain, the appetite was decreased, she could not sleep all the night. Hipotorium 200 every 6 early was prescribed considering the intensity of the body ache. The next day, the fever came down to 100 degree Fahrenheit in the morning, but again rose to 101 in the evening time. So increase in the potency was considered. So accordingly, Hipotorium 1 mg every 4 hourly was prescribed. The next day, the body ache came down, the fever was reduced, she was overall better. Hipotorium 1 mg for another 2 days was prescribed and she was better. Now what we learn through this case is that headache is a concomitant is covered by many remedies. And prescribing natromur, that too on high potency, on incomplete totality is not advisable. Second important thing is that the symptom, the intensity of the symptom in the remedy should always match with the intensity of the symptom in the patient. Now I will proceed you to the case number 4, which is a very interesting case in a way that we normally encounter in a bedridden patients. Now this is the case of a 77-year-old female who is bedridden since last 1 year due to hemiplegia. Her MRI brain revealed that she had got multiple lacunar infarcts with age-related atrophy. She was taking symptomatic treatment for constipation, hiccup, etc. with us. Most of the time, opium would help her. On 7/6/2011, her son reported that she has developed fever with a cough that is rattling in sound. Her urine output became less. She did not pass motion since last 1 day. She was drowsy. Now, the thing is that we have to consider here the age of the patient, the paralytic condition, along with that the rattling cough. So seeing this picture, antimony tart 10 mg was prescribed. The next day, the fever reduced down, the cough was little better, she passed good amount of urine also, the stool was also normal. The fever came down the 3rd day, but still mild rattling cough persisted down. Baratacap 1 mg was prescribed for another 2 days. See, after giving Baratacap 1 mg for 2 days, the rattling cough which was there came down and she recovered fully. Here, the age of the patient and the clinical condition demanded another set of or another group of remedies. Remember Baratacap always when antimony tart fails or its action is insufficient. Now, hope so, the cases which were presented by our association will give confidence in treating cases of fever. Thank you very much.